a lot of times when you kind of do the self-adjustments, you get this stuff that's already moving really well, and that sticky guy still stays there. So we're going to do a little push right here.
Oh my gosh. Sorry, that's like not what I expected.
A little bit different than when you do it yourself. Let's have you go ahead and go face down. We've got the table set up for you.
Are shoes okay?
Yeah, you're fine with the shoes. Perfect. I'll kind of make sure. Is that comfortable on belly for you?
Yep.
Okay, perfect. So first thing we're going to look at is our sacrum. So we're looking at quad tension. So we have a little bit more on this left side. The whole purpose of Webster Technique is to kind of even out the pelvis and hips so the uterus sits into a neutral position and baby gets to have more space. So a lot of times with breech, it can help baby kind of sit into a better head down position.
Cool.
So we're going to start with drops, which sound a little bit loud.
Mm-hmm.
Table's going to pop up, make a really loud sound. And we're going to do a push right here on the sacrum. Good. Doing okay with that? Yeah. 2 more. And then we recheck. And that actually evened out. So let's go ahead. I'm going to have you sit back onto your knees, and I'm going to take this pillow away from you. We're going to pop the table back up, and you can face me on this side here. So with Webster Technique, we usually just adjust one side.
Okay. I didn't know that.
And that way, we're adjusting the pelvis in the way that it's affected.
Okay.
Alright, and are you comfortable here?
Mm-hmm.
Alright, so we're just going to do a little push here. Good. Nothing too crazy. Let's go ahead and go onto your back. And then round ligament is typically on the same side, or on the opposing side of the sacrum. So we just adjusted this side. Round ligament is usually a little bit more tender on this side, and you can kind of feel that.
Yeah, I can.
So this side doesn't have as much tension.
Okay.
So just some trigger point release. I'm going to hang out here if you want to come over so you can kind of see where my hand is. So that round ligament sits right where the belly button and the ASIS kind of right in between that. We feel more tension here versus not as much tightness here. And this is something that mom can actually do as well to kind of help that stuff.
Okay.
But usually just hanging out here for about 30 seconds, we can start to feel that release. We feel baby moving around in there a little bit. Like, what's going on out there? Baby's ready to go too.
Yes.
So, and then you said you have acupuncture later today?
Mm-hmm. Yeah.
Sweet. Cool, so let's recheck. I'm going to hang here a little bit longer. Can you feel that? So if you put your finger right here and then on the other side, do you see how that side's a lot more tight?
Yeah, for sure.
Kind of cool.
Yeah.
So I'm going to take over again.
Okay.
So pretty easy and gentle technique
Yeah.
with Webster, and it's really cool how effective it is. Like you can feel it very immediately. Like usually those drops aren't, a crazy big adjustment. It sounds really loud, but we recheck and you can kind of feel everything even out.
Cool.
And baby's like, I'm ready to go.
I know. She doesn't like to be poked and prodded at this point. She's like, I'm trying to do my thing here.
I don't know, trying to get a nap and there's all these noises and cameras on me. Awesome. Cool. So good stuff. We'll keep it with that for the pelvis stuff today. And I'm going to take your hands. You're good with the adjustments where you've been on your back. So that's how I usually like to adjust. And then go ahead and come on in here. So can I have you bring your chin to your chest? Good. And one more. prenatal stuff, you're kind of just tension, tightness everywhere. So
Yeah.
good to get
Yeah.
those adjustments. And it's probably been like a year and a half since I saw you last.
That's true.
At
Yeah,
my
it was
old
definitely
office.
like pre-COVID too.
Yeah, right.
When did you move here?
I guess January of last year, so
Mm-hmm.
been here like a year and a few months. And then COVID hit,
Uh-huh.
and I was like, well, what do I do? I had to close down the office for about 6 weeks.
Oh, really? Oh, wow.
Then I bought this camera and started making YouTube videos. So.
Oh, wow. It was just the perfect opportunity.
Yeah, it turned out to be a good thing. So. And your neck's been feeling okay?
Yeah, really loose actually. You know, just with, I think, all the hormones, I can like pop it pretty easily.
Yeah, that relaxing makes everything
Yeah, I don't
easy.
know if I'm doing anything like helpful when I do that, but
Yeah, so a lot of times when you kind of do the self-adjustments, you get this stuff that's already moving really well, and that sticky guy still stays there. So we're going to do a little push right here.
oh my gosh. Sorry, that's like not what I expected.
A little bit different than when you do
Yeah.
it yourself. All right, and same thing here. Awesome. Those are good. Awesome. Let's so we'll run through extremities.
Okay.
Just to kind of loosen everything up. Usually induction likes ankle stuff.
Yeah, yeah.
So maybe we'll be running to the
I know.
hospital.
I know, I'm like, I drove myself here.
All right. A little push here. And
Someone at Botanical Wellness Sanctuary.
okay.
Yeah. I've been going there for years for acupuncture, so
That's great.
yeah, they specialize in fertility and prenatal, postpartum.
Okay.
Yeah.
Yeah, acupuncture is the best. I just started doing dry needling.
Oh, yeah.
About a year ago.
Oh, that's awesome. Yeah, I do some E-stim with my
Yep.
acupuncture. It's
Oh,
yeah,
that's
it
what we do
makes
here.
yeah, it's super effective.
It's a game changer.
Yeah, for sure.
Cool. Well, let's keep it with that for today.
Okay, great.
Thanks for watching. If you enjoyed the video, do me a huge favor and click on that like button below. And if you want to see more content like this, click on my face right here to subscribe so you don't miss out.
I just bought a new whip. Spend a couple thousand just to cruise it. Shawty said she love me, but I swear she'll never prove it. I never tell her, but I put it in the music. Well, that's okay. All I wanna do is make